Welcome to AETCM, the Emergency Medicine channel. In this module, we are going to discuss the drug fentanyl. In this module, we are going to discuss the classification, the mechanism of action, the metabolism, the indications, the contraindications, the complications, the routes of drug administration, and finally, the dilution of fentanyl. So first we come to classification of fentanyl. Fentanyl belongs to sympathetic opioid analgesic. Coming to the mechanism of action, it is a sympathetic opioid agonist that binds to the mu receptors of the CNS, thus inhibits the ascending pain pathway and thus altering the pain perception. It also decreases the sympathetic response and can decrease heart rate and BP. So, the mechanism of action is primarily, it is a sympathetic opioid agonist that binds to the mu receptors of the CNS and inhibiting ascending pain pathway, thus altering the pain perception. Now we come to the metabolism of fentanyl. Fentanyl is metabolized mainly by the liver by the P450 enzymes and it is excreted through the kidney. Now we come to the route of drug administration of fentanyl. It is available as IV preparations, IM preparations, transdermal, transmucosal, sublingual and nasal sprays. So, it is available as IV, IM, transdermal, transmucosal, sublingual and nasal sprays. Now we come to the dilution of fentanyl. So, 1 ampule of fentanyl contains 100 micrograms, which is equal to 2 ml. In this 2 ml, we will mix it with 8 ml of NS, thus making it as 10 ml. So, each 1 ml will contains 10 micrograms. That is, this 10 ml contains 100 micrograms. So, 1 ml contains 10 micrograms. So, come to dilution, it is available as ampules and 1 ampule contains 100 microgram, that corresponds to 2 ml. We will take this 2 ml and mix it with 8 ml of NS, thus constituting 10 ml. Hence, this 10 ml contains 100 microgram of fentanyl. Thus, a 1 ml of this dilution corresponds to 10 micrograms of fentanyl. Now we come to the indications of fentanyl. So, fentanyl is used for procedural sedation, analgesics and pain management and also for rapid sequence intubation. So, for procedural sedation and for analgesic and pain management, it is usually given as IV preparation of around 25 to 50 microgram or as IM preparation of 50 to 100 microgram. For procedural sedation, we are giving at the dose of 0.5 microgram per kilogram, and for a rapid sequence intubation, it can be given as 1 to 3 microgram per kilogram. Now we come to the contraindications of fentanyl. Coming to the contraindications of fentanyl, hypersensitivity to drug, bronchial asthma, paralytic ileus, any GI obstruction and surgical abdomen like appendicitis, pancreatitis, etc. Those are relative contraindications. So, the contraindications include mainly hypersensitivity to drug, respiratory depression, bronchial asthma, paralytic ileus and GI obstruction and surgical abdomen like appendicitis and pancreatitis. Now we come to the complications of the drug. So, coming to the complications, in respiratory system, it can cause hypoventilation and in CVS, it can cause decreases the BP and the heart rate, and in CNS, it can cause mild sedative effects, and in skin it can also cause rashes. So respiratory system, it will cause hypoventilation. CVS, it will decrease the heart rate and the BP. CNS, causing sedation, and in the skin it can cause rashes. So we have discussed the classification, the mechanism of action, the metabolism, the indications, the route of drug administration, dilution, complications, and finally the contraindications of fentanyl. Thank you.